Hi, I'm Dr. Nick Shaw. This is Ingrid, and this is Maska. Maska is a 3-year-old female Malamute Husky cross, and she's a beautiful dog. And by the way, she doesn't have any problems with her hips or her knees. But today we're going to talk about hip dysplasia, and I'm going to explain what goes on. Of course, the hip joint is also called the coxofemoral joint, and it's an important joint, as we know. People often have hip problems, and I'm going to show you a model. First of all, hip dysplasia itself is a developmental problem where the hip joint doesn't grow properly in the young dog. And what happens is the ball of the hip joint and the socket don't fit together very well. The socket is too shallow and the ball doesn't develop properly. And when that happens and the dog bears weight, the hip joint wants to pop right out of the socket. So it's continually rubbing like that. And the problem that develops when that happens is the dog will develop arthritis in the joint. So on this other side you can see how nasty and gnarly that looks. This is the dorsal acetabular rim, and that's the body's attempt to try to stabilize the hip. So preventing hip dysplasia means keeping your dog slim during the growth phase. Large breed dogs should be fed a large breed puppy food so that they don't grow too fast and their calcium phosphorus is ideally balanced, and try to get a dog that is not genetically predisposed by making sure that the breeder has tested the parentage of the dog, that they don't have hip dysplasia. If we detect hip dysplasia in a dog by 4 months of age, there is a surgical procedure we can do to make sure that those hips, or to try to make sure that those hips develop better as well. So you should have your puppies examined by a veterinarian prior to 4 months for laxity in the hip joint that might indicate a predisposition to hip dysplasia.